Thanks for watching the ED Explained expert advice on treating erectile dysfunction video series. Hi, I'm Dr. Jay Simhan. I'm a urologist at Temple Health in metropolitan Philadelphia. I specialize in men's sexual health, including erectile dysfunction. I'd love to talk to you about prostate cancer treatments and erectile dysfunction. Now, prostate cancer treatments really run the gamut. There's some patients that have advanced disease that might need hormonal therapy, but thankfully, due to screening, many patients have localized prostate cancer that's very treatable. And many of those patients elect for surgical therapy, which involves prostate cancer removal. Many times in the United States, that's done robotically as well as around the world. And sometimes patients might elect also to undergo radiation therapy, which is also a proven guidelines-based treatment for prostate cancer. And some patients, frankly, might warrant both therapies, where you need to undergo both surgical therapy as well as radiation therapy. And it's really because of the aggressiveness of the cancer. Now, the reason those treatments work is they really eliminate cancer. But in doing that, they sometimes affect the blood flow to the area of what may cause erections, and it might then cause an impaired erection. So both surgery as well as radiation, as well as both, can create a scenario where the blood flow to the penis just gets impaired. And if you're a patient suffering from prostate cancer, you might then have an erectile dysfunction problem. Now, prostate cancer survivors, however, live, and that's a great thing. It's amazing that today, many men that have prostate cancer are able to live decades after they've been treated. But it's unfortunate, though, that some of those men develop an erectile dysfunction problem. In fact, some studies have even suggested that even upwards of 50% of people that might have undergone prostatectomy, or upwards of 50% of people that might have undergone radiation therapy might suffer from a poor erection. And many times patients say to me, well, does that mean then that I don't want the treatments? And I'd say to them, but these treatments help you live, and they help you live many years. So I strongly recommend that patients should undergo prostate cancer treatment. And the reason is, even if a patient were to suffer from a poor erection, there's so many treatments that can actually help you in recovering and maintaining, if not improving, your quality of life following beating and fighting prostate cancer. Now, some of the treatments that are out there are really guidelines approved, and I'll spend just a minute or two talking about those. There's erectile dysfunction pills that really are called phosphodiesterase inhibitors. They're very common on the market. You might see them advertised on TV that help in generating good blood flow to the penis. And there are some side effects, of course, that you could talk about with your physician, but many patients do not have a side effect, and many patients have good results with them. But upwards of 1 in 5 to maybe even 30% of patients that try a pill might not have a good response. Other patients might try penile injections, and that sounds a bit crazy that you would inject your penis in order to get an erection. But again, I think if people are motivated to do so, it is a good treatment. And I tell people often, the needle actually often does not hurt. What you're supposed to do is inject your penis with a medicine, and within 10 to 20 minutes, it's supposed to work such that you get an erection. And it should be a natural erection, and it should last, if you have the right dose, for the right amount of time. There are other types of therapies that might involve medicines that you can insert into the penis. There could be external devices that can help promote an erection called a vacuum erection device. But ultimately, patients might choose from these types of, constellation of treatments. But if they're frustrated or they lack spontaneity in their relationship, many people settle on a penile implant. Penile implants are really what they sound like. It's a device that's placed into the penis that helps restore both the function and form of the penis to allow men to be able to generate an erection. Penile implant procedures are really done quickly. Many times the operation is under an hour if done by an expert, and oftentimes it's placed through an incision, just one incision, maybe about this big, that allows the penis to accept this device that has a component in the penis, a small component in the scrotum, and a small component in the abdomen. Those components really work together such that the patient's able to inflate their penis using this pump device that's placed in the scrotum, and they're able to generate for themselves an erection. The penile implant's a time-tested strategy that's been around for many decades. The penile implant is an excellent treatment for those men that are suffering from erectile dysfunction problems that have been frustrated by many of the other treatments that I might have mentioned to you earlier, or they might simply want to move forward with something that's more definitive because they're unwilling to accept the risks of some of the other treatments just mentioned a few minutes ago. Again, I think this is an excellent opportunity for men to educate themselves on the various types of treatments available to them. If you're a man that's suffering from prostate cancer, or if you're watching this video and there's a loved one in your family that is suffering from prostate cancer. Again, often with penile implants, the question comes up, who should do my penile implant? And is it really true that this can be done so effectively? And I would say that oftentimes, like most conditions, the experts really have the best outcomes. And if you're listening, I would suggest that the Coloplast Men's Health website has a list of experts recognized for placement of the penile implant in safe ways that can benefit many patients. Thank you again.